My name is Dr. Brett Gilbert. I'm an endodontist and I've been practicing for 13 years. TF Adaptive has really exceeded my expectations since I started using it. The system is designed to be very simple, but also to give you wonderful performance in an endodontic file. The best part about TF Adaptive is that it has an adaptive motion technology, and this really allows the doctor to stay safe. Safety in endodontics is really all we can ask for because we really don't want to leave any instruments behind. So having a system designed to really keep you safe but give you extraordinary performance is really ideal. So I have found that TF Adaptive in my practice has been a wonderful addition because I can do excellent performance in my endodontics but also know that I'm going to be safe and not have to worry really about separating instruments. The way that TF Adaptive differentiates itself from other reciprocating motor systems is the fact that TF Adaptive actually rotates in full rotation first before reciprocating. Other systems simply reciprocate back and forth as they work their way down the canal. By not being able to do the full 360 rotation, the debris in essence gets caught and gets kind of jammed down into the canal. So other reciprocating systems, although they claim safety, which is absolutely true, they lack performance because they are actually pushing debris down into the canal. Now, the techniques involved with those systems are much more labor intensive because removal of this debris requires a diligent effort by the doctor. Whereas with TF Adaptive and adaptive motion, really that debris removal is done for you just by using the system. Using the TF Adaptive file in my practice has really been great. It works so well. The reality is that it's very flexible, but it also cuts very effectively. And of course, it's a safe instrument with the TF Adaptive system. But what I would say is most striking about the TF Adaptive file is that it really is so flexible that it's able to capture the natural contour of the canal, unlike anything I have seen before. In the past, file systems I've used gave me, in essence, kind of a similar looking shape to each canal that I prepared. It may have had a bit of curvature to it, but it always looked kind of the same. Whereas now I'm really seeing this unique characteristic where the natural canal contours come through in the obturation, and I know it's due to the fact that the file is able to really capture the natural anatomy by not causing its own preparation, but more or less following that natural contour. And that has been really a revelation in the types of cases I'm able to kind of complete and send off to my referring dentist. The confidence I get of using the TF Adaptive system, really in comparison with other files, is kind of this very smooth cutting feel. The reality is in other systems I've used, there are a tendency for the file to actually feel like it's pulling you into the canal. Very unsettling feeling for the clinician. TF Adaptive does not allow that to happen. Again, because of the adaptive motion technology and the reciprocation, you're not going to get the type of engagement and pull that you might feel in other file systems. If I were advising a general dentist looking to increase endodontics in their practice and maybe looking for a new system, I would highly recommend TF Adaptive. The system is simplified from top to bottom. It's simplified in the fact that it's color-coded, which makes it easy for your staff to follow during treatment, also when you need to restock or order. But from the doctor's perspective, it's a 3-file system. It's really easy to progress from one file to the next. And the best part about TF Adaptive is it's probably the first system that really safely allows you to apically enlarge the canals. We know that the apical third of the canal is the most complex anatomy, and being able to remove tissue, debris, biofilm, and then be able to irrigate that effectively really will give you the best possible results. So for a dentist looking for a new system who's not using one now or is looking to switch, I think checking out TF Adaptive would be probably a great course of action.